Let's focus the attention now on World AIDS Day and take you to the Northwest Province. The government there will join the country and indeed the global community in commemorating World AIDS Day under the theme, Let Communities Lead. The officials are offering health, education and screening services to community members in the Huhudi township. And that's where we find Refiloe Seboko, our reporter, live for us there. Refiloe, good morning to you. The theme, very self-explanatory, the theme around this World AIDS Day, and that is to let communities lead. How are communities such as the area where you are dealing with the prevalence of HIV/AIDS?
Well, Polly, making focus of communities, the guest that I'm about to have now was just telling me that there seems to be lack of information and that is why they have not seen much being done about infections of HIV and AIDS, particularly in the Dr. Ruth's community here in Huhudi village, where this commemoration is being held. And allow me to welcome Mildred Marupefela. Thank you so much and welcome to Newzroom Afrika. We were talking a bit earlier that you are happy that this commemoration is happening here in Huhudi because there seems to be lack of information, particularly when you're talking about a theme that says communities must lead.
Thank you very much. Thank you. I appreciate it. Indeed, I'm the most happiest person because this district where we are right now is one of the districts that have been left behind in many years, and I don't know for what apparent reason. We've been focusing the whole of Northwest, but for some reason leaving this one behind. So with the theme, let the communities lead, and where we are based right now, the sports ground, the dusty, I love the word dusty for sports ground, it indicates that indeed we have penetrated the communities. We are not somewhere where it fits the privileged few. We believe that indeed the theme is relevant for this particular commemoration.
For this particular commemoration in terms of HIV and AIDS infection and how as the Provincial Council of AIDS, what are you noticing in the province in terms of the treatment and the progress made in terms of dealing with infections?
So far I would say there are still gaps that needs to be filled in. But we know we have adopted the AIDS 95-95-95 strategy according to the National Strategic Plan, NSP. We are still lagging behind, obviously, as a province, and more especially district, because when you check most funders, they are mostly based at Bojanala and Dr. KK, so we are still like having to see to it that all the districts as general should be like covered, really equal coverage in the province without omitting other districts. But so far I would say with the youth leading, that's why today even we have Sikhala Kanjani, a youth that is led mainly by youth. So we believe with youth taking the lead, we are definitely on the right route.
You were also talking about some stereotype and stigmatization mentalities that are still there, particularly within the LGBTIQ communities.
There's a lot. Our people still believe that HIV can only be transmitted via heterosexual couples, that is your male and female. To me, I was surprised sometime yesterday when I was confronted by a young man in this very same district, asking me whether can a male actually transmit HIV to another male. And to me, it showed me that there's lack of information because we know as key populations, MSM, men who have sex with men, they are at high risk of transmitting HIV to each other more than your I don't know to say your normal whatever, but your general population. So it shows like there's a lot of work that still needs to be done. Stereotypes, misconceptions, and lack of information under general, lack of education under general.
On a day like this, from the Provincial Council of AIDS, what's your message?
My message is that, guys, as long as we are together, we need to unite. Let the communities lead, not only today, let the communities lead throughout. Let it be a project, 365 days. That means a whole year. The focus from PCA, from Premier's office, from business should be, we should go to the grounds and spread the message and educate our people, emancipate them from this epidemic, because right now we are at the stage whereby I think we are liberated to speak freely about these diseases. Our clinics right now, banally medication, any medication, we have routines on the ground that make sure that there's no stock out in the clinics and in hospital. So ours is just to encourage people, educate them on the importance of adherence, period.
Thank you so much for your time. The importance of adherence, that is the message colleague here today in Huhudi as this commemoration of the World AIDS Day. The official program has not started. It is expected to start at 10 o'clock. But we see community members that are here, came in numbers, colleague. They are also getting some help, services from the different stalls that are here. We'll keep you updated together with our viewers on how the program is unfolding this site.
Refiloe, Seboko, thank you very much. Live for us from the village of Huhudi, and this is in the Northwest Province.